Okay, let's talk about long hair transplants. These are probably some of the coolest transplants that exist, why we would use them, and why we don't use them most of the time. So, long hair transplant is we're transplanting the full length of the hair from the donor site, its full length, into the recipient site to see a preview of what the final results look like, which you can't do with a normal transplant and why it's so amazing. Now remember, in a regular transplant, we usually buzz down the sides and the back of the head in the male, or we lift up a little area and buzz and grab hairs out in a discreet fashion in a man or woman who wants to hide their procedure. And in each one of those cases, the hair we're actually grabbing is been buzzed down to the skin and we transplant this little stubble. However, with techniques like micro, where we're no longer using a rotary blade that can get hairs caught up in it, we're using vibration. And the surrounding hairs don't get caught. So we can actually extract a full-length hair from the donor site and put it in the recipient site and get the result we want on the table, which means while you're in the procedure. We can see exactly what we're going to get. And we can extrapolate, maybe 10% of these hairs won't live, but wow, we can actually do 110% of the transfer, and we can get exactly what we want a year down the road, not have to wait for it. Well, that sounds perfect, but it's not. There's actually a lot of problems associated with discrete hair transplant. Number one, remember we're doing, with a long hair transplant. Number one, it's fundamentally a discrete hair transplant like we created. And we know from that you're working through a forest trying to find the hair you want for a very particular area on the scalp that you want to recreate, like a front hairline where you want a single fine hair graft. You may think you're seeing one. There could be a hair right behind it that's associated with that same follicle. And when you transplant it in the scalp, it's a coarse 2-hair graft in the front hairline. Now, you have problems long down the road. So these discrete and long hair transplants are really meant and ideal for the mid-scalp and the crown. But why would you do them there if they're not necessarily provide the same value with the long hair that they would in the front hairline, where they are problematic? Another problem with the long hair transplant is that you now have a rope essentially attached to your follicle, which during aftercare, when you're sleepy and you're groggy and you're taking showers and you're already afraid of these hairs, you can now tug on at any moment in time and pull out that follicle and ruin your results overall. And that's one of the reasons we don't do them. It's actually hard to care for. But I can tell you, nothing beats the preview feature of a long hair transplantation. So if we're going through a very difficult restoration where someone's already had a procedure or someone's very particular, we want to see the exact density what they're going to get, we're going to pull out the long hair technique. And that's only possible with micro multiphasic extraction or other techniques like it, where we use vibration or suction with hairs versus rotary cutting.